Your doctors are depending on a special band of unsung heroes to help them treat your cancer. At LLS, we call these heroes the Extraordinary League of Blood Cancer Tests. Today, we'll meet an elite squad of tests that are able to measure minimal residual disease, or MRD. If your doctor is testing for MRD, you may have questions like, what exactly is MRD? And what kind of test might my doctor order? And which MRD test am I having? So let's start with the first one. Just what is minimal residual disease? See, your doctors will often need to check to see how many cancer cells remain in your body. Those remaining cells are called minimal residual disease. Some of the most common tests that measure MRD are flow cytometry, polymerase chain reaction, or PCR, and next-generation sequencing. These tests may show MRD positivity, which means residual cancer cells were detected in your body. MRD negativity indicates that cancer cells were not detected. Studies have shown that MRD negativity is associated with longer remissions and potentially longer rates of survival for certain blood cancers. As you might guess, your doctors will want to do these kinds of tests often, both during and after treatment. Still, you might wonder, why might certain cancer cells stick around after therapy? Well, it may be that you still need more treatment, or that the treatment itself wasn't completely effective. See, it's not uncommon for some cancer cells to become resistant to certain therapies over time, and not all cancer cells respond to treatment the way your doctors would like. Now, the number of cancer cells we're talking about is very small. Fortunately, these tests are so sensitive that they can often find cancer recurrence sooner than other tests, and can even confirm and monitor if you've gone into remission. They can also determine if you're more likely to relapse or if you need to restart a treatment or begin a new treatment. What's more, they can even pinpoint which specific treatments you might respond well to. How do your doctors perform these tests? Many of the tests require a sample of your bone marrow, which is the spongy tissue in the center of most bones that produce blood cells. Other times, all they'll need is a small sample of your blood. Your doctor can give you more details on how each specific test is administered. But no matter how the test is done, remember, these advanced tests are incredibly sensitive and can really give your doctors confidence in assessing how your treatment is progressing. So fear not, this elite squad of tests, along with the rest of the Extraordinary League of Blood Cancer Tests, will always be there to bravely light the way on your journey towards recovery.